This is the Watchman FLX LAAC implant, a one-time procedure that delivers a lifetime of stroke risk reduction without the bleeding risks associated with lifelong oral anticoagulant therapy. It's one time for a lifetime. The Watchman FLX implant is for patients with non-valvular atrial fibrillation who are at an increased risk of stroke and need a solution to OACs. Evolved from 20 years of Watchman innovation and the experience gained from over 200,000 successful implants, the Watchman FLX implant is the LAAC technology with proven safety and trusted patient outcomes. In the Pinnacle FLX clinical trial, the Watchman FLX implant demonstrated a 99% implant success rate with a low 0.5% major adverse event rate. Over 96% of patients were able to stop OACs at 45 days, and 100% effective LAA closure was demonstrated at 12 months. Built on the most studied and implanted device in the world, the Watchman FLX implant demonstrates advanced procedural safety and performance with the ability to expand the treatable patient population. Using proprietary engineering, the Watchman FLX implant is designed to treat the widest range of NVAF patient anatomies. In non-valvular AF, more than 90% of stroke-causing clots that come from the left atrium are formed in the left atrial appendage, or LAA. The Watchman FLX implant is designed to permanently reduce the risk of strokes that originate in the LAA. The Watchman FLX implant procedure time is typically less than 30 minutes, and the average hospital stay is 1 day or less. Using a standard percutaneous technique, the implanting physician inserts a guide wire and vessel dilator into the patient's femoral vein. Then, using a standard transeptal access system, the physician crosses the intraatrial septum. The physician advances the access sheath over the guide wire into the left atrium and navigates it into the LAA over a pigtail catheter. The physician then deploys and releases the Watchman FLX implant in the LAA. Hard tissue grows over the implant, and the LAA is permanently sealed. Patients will then follow the post-implant drug regimen as prescribed by their physician. In clinical studies and real-world experience, the Watchman FLX demonstrates reductions in stroke risk and bleeding risk associated with lifelong OAC therapy. In the Pinnacle FLX IDE clinical study, a trial designed to establish procedural safety and LAA closure efficacy, the Watchman FLX implant demonstrated a 99% implant success rate with a low 0.5% rate of major adverse events. And more than 96% of patients were able to stop OACs at 45 days. The low 0.5% event rate shows a statistically significant difference to the performance goal set for similar safety endpoints in previous Watchman studies. Designed for enhanced LAA closure, Watchman FLX demonstrated 100% effective closure at 12 months. The Watchman FLX is indicated and covered for a broad range of patients, including patients that have an increased risk for stroke and are recommended for OACs, are suitable for short-term OACs, and have an appropriate reason to seek a non-pharmacologic alternative to OACs. Most common patient types recommended for the Watchman FLX include those with previous bleed risk, future bleed risk, lifestyle risk, non-compliance, and drug interaction. This is the Watchman FLX implant, the #1 doctor-recommended LAAC implant. Proven, safe, effective. It's one time for a lifetime. To learn more about the Watchman FLX implant, visit watchman.com/HCP.